Welcome, everyone. We're going to get started now. I'm Emily Headley. I'm the marketing assistant for Mr. Bustillos, and it is my pleasure to start off this webinar, Enrolling Individuals and Families. You're going to get exclusive information, so take massive notes, get in a quiet room, and pay real close attention. So if I may suggest, for the next hour, unless it's an emergency, put your cell phones on mute so you can focus on what we're doing. Regarding your presenter, Mr. Bustillos, he's a 20-year veteran. Mr. Bustillos has been written about nationally for what he's done in the profession. Through the agency, we've worked with thousands of families over the last couple of decades, been very successful in the insurance practice, and helped train hundreds of agents. So do yourself a favor, pay very close attention, and without further ado, Mr. Bustillos, can you hear me?
I can hear you loud and clear. Can you hear me?
Yes.
Fantastic. Thank you so much for that great introduction. And I want to just tell you very quickly, we're very fortunate to be working with Ms. Headley as well as the rest of our staff. And we're going to go ahead and get started. If you have any questions, if you need help down the road, if I'm not available, you can always reach out to our staff who are ready to help you and very able and very willing individuals. So with all of that being said, guys, I am super excited about what we have happening. There couldn't be a better time in our profession to be doing what we're doing. And it's just very exciting to be able to participate in some of these events as they're happening within the profession. So I want you to just do yourselves a massive favor. And as we're getting started here, just take all the notes that you can, get in a nice quiet area, and put your questions together. I want this to be a learning session. My goal is to deliver some value to you and help you just really learn how to play into this, because there just couldn't be a better time for our profession than you can see right now. So with all that being said, it's important that you know this information that we're going to share with you, we do not share with agents unless they're contracted. So because you're on the call, we consider you not just a next level agent, but a contracted agent and an agent we want to do business with. So I want to be clear and help understand that this information that we're going to be going over is our full strategy, and we don't, again, share this with just anybody. Consider yourself special to be on the call. We're looking to partner and work with agents in the community that want to make a difference, that want to serve others, and that along the way are going to make a lot of money. So having gotten all that taken care of, guys, we're going to go ahead and get started. The first thing I want to do is I want to just cover the agenda. And we're going to very basic information as far as why we're marketing to individuals and the why, what the psychology is there, the positioning that we're going to be going over in the next 3 years, why that's important, securing an enrollment location, making sure that you have a stake in the community and have located somewhere that's high traffic that you can funnel traffic through, okay, and make sure that you're getting in front of people. FORM, Family Occupation Recreation Message, and the way to begin speaking and having a conversation with people, breaking the ice, getting people to feel comfortable with you, relating to the 4 personality types is another agenda item. Signage and station setup as well. We'll also be discussing the 5-minute screening so that you know whether or not you want to spend time, an hour of your time, invested in a new relationship with the family before they may or may not be a qualified prospect. We're going to go over how to engage with an individual, with the family, a walkthrough, if you will. The first enrollees, the people that you're going to be first visiting at a high traffic location, the people that are looking for coverage today, who those people are, what they're looking for, how to meet their needs. We're going to discuss the auto dollar campaign, websites, how we can help you in that field, as well as additional carriers that we may be contracting. And last but not least, we're going to discuss the importance of the long-term relationship building that we're implementing and we're engaged in, as well as the short-term enrollments. So first on the list is marketing to individuals. The reason that this is important to understand is because when you can master this part of the process, then you can begin to work with people from all different levels and people from all different income classes. And it's really basic, but it's so important. And many people don't take the time to understand the importance of learning to work with and build relationships and really understand the needs of other people because they're so busy talking. So it's really important that we take a step back before we get started down this road, and we just take a moment, if not this moment, obviously later, but Take a minute to figure out what your intent is. Take a moment to figure out what you're after, why you're doing this, why you're on the phone. What's your goal in all this? Is it just to make money? Or is it to make money to pay for your kid's school? Is it to make money to pay for an operation? What's the money going to do for you? What is the point of you working? Now, it's kind of funny, but the reason we do this and the reason I suggest you go down this road is because depending on your intent, depending on where your heart lies, that's where your passion's going to be. And if your passion is in helping people, then not only will you always lead and serve in the right way and have ethics and morals in check, but more importantly, you're going to do it with a passion. And when people are engaged with you and they see and feel that passion, they absolutely want to do business with you. They like you. You rub off. You're infectious. So bottom line, you want to think about why you're doing this. Whatever that reason is, be passionate about it. Sell out to that. Sell out to your reason for doing this and engage in a big way. Now we're in the game. So leave nothing on the field, guys. Start with the end in mind. You know, Stephen Covey in his great book, The 7 Habits of Highly Effective People, talks about what the top professionals and what the most successful people, the happiest people in the world, what they've done and some of the habits of those individuals. Great read. I highly recommend it to anybody that can read the book. That, you know, you should read the book. It should be a part of your personal and self-development. One of the things he discusses is to start with the end in mind. Again, if your heart's in the place that it is and you're wanting to help people and you're wanting to help grow relationships, you're going to make money. There's no question. The better you get at it and the more passionate you are about it, the more other people are going to hear about you. And them buying insurance from you, that's just a fact. That's just going to happen. That's the natural consequence of them being around you. They're going to want to buy insurance from you. This is called attraction marketing, folks, and it's what works most effectively, more effective than any other kind of marketing, is that you attract people to you. So when you start with the end in mind, again, we're discussing goals. We're talking about where you want to be in the next 5 years. We're talking about where you want to be in the next 10 years. Make no mince about it. Mincing words about it, rather. Know that if you don't have a plan, you're going to end up wherever you go. If you have a plan, you're going to get closer to that plan. Whatever your goal is, if you have one, write it down. It doesn't start to materialize it until you write it down. So it's really important that you know where you're going. Decide, as of today, that you're going to be using a system rather than being random. And there's a point to this particular bullet, because if you work through a system, then you can have a way to monitor and measure results. You'll have a way to gauge whether you're doing good or bad. You'll have a way to know whether or not what you just did is working, if it's providing results. And you track this information over a 3 to 6 to 9 month, 12-month period, rather than just going at things kind of in a random fashion and really not taking the time to study the metrics, which are very important in any marketing. And then you want to stick to a marketing plan. Whatever that marketing plan is, whatever your goals were that were set, whatever your drive and passion was behind getting it started, stick to it. This is the 6 to 12-month project for most of you getting started. If you've never done anything like what we're talking about doing on the phone now, you want to make sure that you understand this is a long-term process. We're talking 5 years down the road, guys. It's a long-term deal. We're talking 10 years down the road if you're serious about the profession. Now, in the meantime, you're going to make money next month. You're going to make money the month after that. But it's because you start with the end in mind and that goal that you make better decisions. You make longer-term decisions. You invest in your development. Very important. So the launching of your business, or relaunching, if you will, in this new strategy in terms of marketing is super important, because there's a base of people that you already know. And when you start something new, whether it's a campaign, whether it's a project, whatever it is, like what we're doing now, you want to take stock of where you're at. And it's important to understand you already have a circle of contacts around you. I would highly recommend that you take a moment and that you take the memory jogger that we sent to you, would have been in step 1 of the emails that you received from us, and we will make it available to you via email. It's also at the Enroll.org website, step 1. You can find the memory jogger there if you go to the website, Enroll.org. And you download the memory jogger and you go through the process and the list building, because these people are going to talk to somebody about insurance. Why not you? They already know you. They already trust you. They already like you. Hopefully they like you. You know, and the point is that the 3 things that need to exist for any relationship to get off the ground, especially when someone is buying and selling, is that people need to know, like, and trust you. And if they know you, like you, and trust you, well, you've already got an advantage. Well, why not start with the people that know you? I'll tell you right now, they're going to talk to someone. So it's just a major loss if you don't take advantage of that and get to talking to those people before somebody else does. And if you can master this micro, okay, if you can learn the fundamentals of these concepts, working with individuals, then the macro, working through groups, becomes very simple. But if you try to do it backwards, guys, you're going to mess up all sorts of things along the way and really not launch properly. So in the current moment, the timing couldn't be better. I've said that time and again. We're in a particular situation where everyone is discussing affordable health care. Everyone is discussing Obamacare. This is all over the news. You're going to see stuff happening online. You're going to see advertisements from Blue Cross Blue Shield. You're going to see information coming at you from community events. You're going to see the news is reporting on this and that. People are doing town hall meetings. The timing of this is just incredible. Now is the time for you to be posturing and positioning you as a practice, you as an individual, learning, excelling at learning, and really putting yourself in a situation where in the minds of other people in your community, you're the go-to guy. You want to make sure that you can take advantage of the current moment and the trend and really, over the next 3 years, become known for what you're doing. Have people learn where you are, who you are, what you're doing it right, so that it becomes simpler and more efficient and faster for you to get people to you in your endeavors to sell them insurance. So, securing an enrollment location, next bullet point on the agenda, is a fairly simple process, but there's some thinking that does need to go behind this. So the first thing you want to know is schedule some meeting times with people in your local community wherever there's high traffic. We're going to talk about how to do that in just a second. What's important is that you've secured an enrollment location where a lot of people are visiting, a lot of people are going through. Why? Because if you're visible, well, you just tapped into a very natural resource of whatever's happening in that area. So here's an example of some high traffic areas: pharmacies, hospitals, doctors' offices, tax offices, especially during the tax season, obviously, schools, private, charter schools, parochial schools, small community. You can work with the public schools, okay, grocery stores. All of these types of locations have a lot of traffic. Positioning yourself in the right way in those locations with some signage just makes you super visible and will generate a lot of leads, thereby a lot of contacts, thereby potential sales. So when we did this with Medicare, that was the exact same thing that we did, and we were able to take advantage of it in a massive way. So the setup, as you're getting ready to set up an enrollment with a particular location, is pretty simple, guys. You want to make sure that you have the right signage, that you have the right location set up, and we're going to talk about that more in just a second. But before we do all of that, you want to know where you're going to set up your enrollment location. If it's a pharmacy, who you're asking for. So do yourself a favor. Don't call into a location and say, "Hi, is the owner there? Hi, I'm doing this and I'm doing that, and I wanted to talk to whoever's in charge." You don't do that. That's just going to make you look like an amateur. What you want to do is you want to be looking like a pro, acting like a pro, doing like a pro, and you want to go to manta.com, MANTA.com, or BBB.org. And if you can go to manta.com or BBB.org, you'll be able to get the information on who owns a business. You'll obviously go into that particular for the person that owns, to find out who owns the business. You'll be able to download that, and then you'll be able to make a phone call. And as you make a call, you'll be able to speak to whoever it is that will be the decision maker in that situation. And that will allow you to speak specifically to the person that's going to make decisions, rather than people that may not know whether or not they're going to be allowed to. You're going to get screened. Someone's going to pass you off to somebody else. Very important not to do that. So you need to know the psychology behind that call is an owner to an owner. You're an owner of a business. You're calling another owner of a business. Do not, I would highly recommend, come in talking like an agent, talking like a salesperson, talking like someone that's a vendor. Okay, you're going to be treated as such if you do that. As a business owner to another business owner on the phone, the psychology needs to be of you're a business professional operating in the community and you're looking to partner with other business professionals working within the community. That is the conversation. That should be the psychology. When you call this individual, whoever the owner of that business is, let's say we're calling up Patricia Smith, okay? The call needs to be regarding referral business. Hi, ring, ring, ring. This is Jesus Bustillos calling referral business. I wanted to speak to Patricia. That's how you would start that conversation. That'll get you through the screener. There will be screeners, okay? And when she gets on the phone, then you're going to be real simple, and you're not going to pitch, okay? You're not going to go into a whole Obamacare is taking over, and this is why we need to sit down with you. All you're going to do is you're going to look to schedule a face-to-face appointment. So over the phone, you're going to say, this is Jesus Bustillos. This is regarding referral business. So, Patricia, I just wanted to schedule some time to come by and visit with you. I happen to own another business here in the market, and I wanted to come by, see if we're a fit, see if maybe we can do some business together. I've got some people that I want to refer to you, and see if maybe we can do business down the road. So, are you interested in referral business? Absolutely. Great. So, would Monday or Tuesday be better? Would AM or PM be better? You always give an A or B option whenever you're scheduling appointments, never a yes or no option. Okay, well, what is this about? How are you going to do that? Well, I'd like to discuss it face-to-face, but the bottom line is we're looking to get traffic into your store, and we're working with some of what's happening with healthcare, and you're a related industry. We're a local business. We'd like to partner with people like you in the community that are going to make a difference and help people. And so I'd like to come in and visit with you on that person-to-person. I don't like to do this over the phone. So as one owner of a business to another owner of a business, I want to respect each other's time and just have a sit-down, see if we like each other, and maybe we can do some business together. So assuming you're interested in getting referrals, is Monday or Tuesday better? Before you hang up the phone, you want to make sure you ask for a cell phone number. So just in the event that there's an emergency, here's my cell phone number. By the way, what's yours? I promise I'll only call you if it's an emergency. Okay, so that's how you do that. This is a recorded webinar, so you'll be able to get this information, play and rewind over as many times as you need to so you can hear that information again. So you've scheduled a face-to-face appointment. Now you're in the in-person meeting. In the in-person meeting, it's important that you be groomed. Guys, this is important. Comb your hair, brush your teeth, okay? Make your belt match your shoes. Very important as gentlemen that we need to be presenting the right foot forward, and that we are, leading with the right foot forward. Be real, be genuine, don't be fake. You've probably heard the expression fake it till you make it. Well, what it meant is think positive, think that you're already where you want to go. That's what it meant. It doesn't mean be fake. So be real, be genuine, okay? Be you, be warm, be likable, okay? Lead with your heart. When you first meet someone, it's important that you give them a little bit about who you are. Talk about your past successes, okay? Talk about what you've done, whatever the successes might have been. Be real. Be a person in the community. Talk about the things that you're currently doing to work in the market that you're in, what you're looking to accomplish in the future going forward. And then obviously you're going to talk about the timing of what's happening with affordable care and what's affecting their industry. And there's an incredible opportunity for people that seize it and take advantage of it. So what I would normally say in this bullet would be something like, I'm Jesus Bustillos. I happen to own some businesses here in town, working in the insurance business. Been doing that for 19 years, almost 20 years. And we've just always found it a benefit to work with other like-minded business people that want to grow the community, that want to help one another. It's always been easier and better for me to work with people I like, rather than people I don't like. So it's always been just more practical to do it that way. And so I'm not here to sell you anything. I'm just looking to partner with some people that see the same things I do and want to take advantage of some of the current situation as it's happening with the Affordable Care Act. We have a ton of people that we'd like to talk to in this market. We're going to be referring people in this direction if we can agree on us working together. And so that means to you that a lot of potential traffic. So we know that in the future, this is going to be a huge deal over the next 3 years as the expansion of this continues and as people know more about where we are and where we're enrolling and helping people qualify. So it's an incredible opportunity for you. It's an incredible opportunity for us as we look to serve other people. It's a real win-win-win. That you just heard is exactly what I say to people when I go and meet them in person, and then I start asking them questions, okay? And as I start asking them questions, guys, it's important that you listen. The point of asking questions is to get feedback and information so that you know how to proceed and what makes a difference for them. So obviously it's a great opportunity for traffic. Obviously they begin to see that. Most business owners are pretty savvy as far as wanting to get people in their door. Most people that own a business understand that concept. So when you start asking them questions, it's important that you listen with all of your faculties. Listen with your ears, your eyes, your nose, your everything, okay? Tune in. Don't be paying attention to your phone. Don't be distracted by other things. Lock eyes with people. Take notes. Ask them what type of a customer they're looking for. These are things that if I'm a business owner and someone's asking me, trying to do me a favor, who my customer is, this is huge. I'm liking this person. Be that person. Type of customer that I'm looking for. You know, what kind of a market I'm engaged in. Ask the person that you're sitting down with, that pharmacy, that grocery store owner, you know, how they market, what their average sale is, what kind of customer is important to them. Are they wanting more customers to come in and do, you know, reorders of prescriptions or mail order? Are they wanting to have people come in and do durable medical equipment? Are they looking for a type of a referral from another physician? You know, whatever it might be, clue into whatever happens in that particular industry and find what the specifics are in that particular niche and just come in a little bit educated on what kind of customers they might be looking for. Very important to ask because they're going to give you a ton of information, guys, and they're going to tell you what they're looking for, what makes a difference for them. And you speak to that language. Very important. So at the end of the day, it's all about traffic. And you want to begin to make statements that will confer value. The way you do that is real simple. Here's the statement. If I, would you. These are very powerful words. You can refer back to the memory jogger to understand this a little bit better. But the statement is, again, if I, comma, would you. So here's how it goes. If I was able to refer people in this direction, would you find that of value? If I had a table located inside your facility and we were able to serve your population of people that will tell other people about what we're doing in here and bring friends and family because they see we're here and everybody's getting questions answered on this deal, would you find that of value to your customer? Those are the ways that you use those phrasings. Now, why is it important that you learn this? Because it's conditional. It's only going to happen if you. If I, would you. So if they say no, you're barking up the wrong tree. Get out, run, go find somebody else. If they don't find value in what we're proposing, guys, you need to stop talking. You're not talking to the person that's in expansion mode. Obviously, the people we're looking for are people that want to grow a business. So you want to communicate your vision on what's going to happen over the next 3 years. Year 1, 10 to 15% are going to enroll. Year 2, 10 to 15% are going to enroll. Year 3, it's going to be a madhouse. So everybody that's going to be looking for enrollment then is going to be flocking to an area because they're going to want to avoid a $700 penalty. Okay? What they can expect in terms of enrollment and you being in their store, okay, and your interactions together, manage expectations, and what you're looking for in space and what you're looking for in the way of access, okay? And so you want to be clear about these things. You're going to be operating in somebody else's environment. It's very important. Take advantage of that. And the next slide talks about FORM, form, and relating to the 4 personality types. Now, the reason this is very important, folks, is because the better you get at managing relationships, starting relationships, building relationships, the better you get at relationships in general in your life, the easier everything gets. Oh, my goodness. Seriously, the better you get at this part of life, it's more enriching. It's more fulfilling. Everything changes. So it's good to learn these practices because this is what allows you to start to learn where other people's thinking is at, you know, what's going on in their lives, where their pains are. And you being genuinely interested in them makes a difference because then you begin to relate, you begin to understand, and with understanding comes empathy. With empathy comes compassion. And guys, all of those things are important for us to have good relationships in our lives, okay? Very important. So relationships, as we already discussed, is what this business is all about. The people that like, know, and trust you will do business with you. If people don't like you, know you, or trust you, any of those 3, it's very low likelihood that you're going to get them to buy something from you. Just know this, okay? A couple of books that I recommend that you read, very important books, made a difference in my life tremendously, helped to shape really how I think and why I do what I do. Very first one I would say has to be from Mr. Dale Carnegie. He's still on the top bestseller list, still 50 million copies sold. How to Win Friends and Influence People. Incredible read, highly recommended. And then Dr. Tony Alessandra, as you can see here on the webinar, his last name is spelled Alessandra with the Platinum Rule. Incredible information. Absolutely instrumental in how I've learned to work with, people and how to be able to build on relationships. Super important information, guys, okay? So as we proceed, one of the very first things that you want to know as you build new relationships, and a lot of you are going to think this is silly. That's cool, but it's important because most people don't do it. Now pay attention as you're looking at this and as you're reading this, listening to this, because you'll notice most people don't do this. Smile when you're talking and you're having conversations with people and you're the one speaking or they're the ones. Smile. The more you smile, the more other people smile. You got to remember something. Humans are emotional creatures. I don't care if these people, people say they're not or whatnot or whatever. We're emotional creatures. Every one of us is an emotional creature. And when we feel good about interactions with people, guess what? We want to be around those people. When you feel crappy in your interactions with people, guess what? You don't want to be around those people. So it's important that we understand that psychology, and you want to be one of those people that people feel good around. So you want to smile. Smile when you're talking. Smile when you're listening. Smile when you're meeting. Smile when you're parting ways. It's important. It communicates and confers that you're confident, that you like the interaction, that you're warm, that you're welcoming. These are important facets of building relationships, guys. Please don't dismiss this point. Pay attention. Study yourself during the week. See how often you're smiling in conversations. It's going to make a major difference for you, trust me. Now, next on the list is being the interviewer rather than being the interviewed. Very important as you're having these conversations, whether it's securing an appointment for an enrollment location or a one-on-one conversation with an individual or a family, or whether you're talking in a group. You are the interviewer. The moment you start answering questions, just kind of on a random or in a flurry, you're being interviewed, which means someone else has control of the interview. This is very important. I learned this a long time ago in my fact-seeking questions and questionnaires. The reason we have that set up in a profession the way we do these intake forms is because we're searching for certain information. The better we are at getting that information, the better we can serve. So being the interviewer simply means that you are in control. The direction of the interview is going to go wherever you want based on the questions that you're asking. Very important. You're the one that controls that psychology. If somebody asks you a question, you answer the question and then you follow with a second question. Okay, very important. So going back to form and some of the psychology behind FORM, the point of FORM is to break the ice when you're talking to people. As you talk to people, the better you are at having conversations and being genuine and being interested in people, the easier it is for you to form relationships. Take advantage of time and really capture moments in working with people. If you don't believe me, pay attention to where you are with current relationships. When you listen to others, when you're there for others, when you hear where they're at, what's going on in their lives, they appreciate you. They do. They might not tell you, but they appreciate you because you're providing a service. So FORM is about learning about other people, and this is just a questioning technique, a questioning strategy to help you learn about what's going on in people's lives. The F stands for family. The O stands for occupation. The R stands for recreation, and the M stands for message. So family, occupation, relationship, message. And here's just a few examples of what you can use in each of those letters of this acronym. Okay, so F being family. How many kids do you have? Do you have children? Do they go to school? What are they studying? Do they have dreams of doing anything particular? You must be so proud. Do they play sports? Occupation. So how long have you been doing that? What do you do for a living? Did you get a license? Did you have to study? Why did you decide on doing that? How do you feel about what's happening in this way with that industry? How is that impacting your work schedule? What's the general mood of your industry? Is it going up? Is it going down? Recreation. What do you do when you're not working? Do you like doing stuff outdoors? These are just questions you can ask people to get a little bit of better understanding on where they're at in their process. So obviously you would maybe eventually relate them to whatever you're dealing with in the moment in the environment. If you're standing in line with someone, you may eventually come back to, gosh, every time I'm standing in lines, I'm wondering, how long I'm going to be here. And I'm Jesus, by the way. What do you do for a living? Or what's your name, rather? Great. So what are you doing here? Are you doing anything in particular? Whatever the questions might be. Again, maybe a bad example, but you get the point. The point is that you're going to start a conversation with people, whether they're coming to you or whether you're engaging with someone at a counter, whatever it is. The point is that you learn a technique to start having questions and having an engaging conversation with someone. That'll help you a big way in learning how to develop a network, really. So there are four personality types, guys, and this is from Mr. Tony Alessandra's training in some of his books. The four personality types are the director, the thinker, the socializer, and the relator. And the director, about 15% of the population, has a very specific way of communicating. They're kind of guarded. Now, the reason that's important that you know this is because people listen a certain way, okay? And you need to speak the way they listen for you to be clear in your communication. If you're talking to someone that's a director, there's certain ways that they listen, is what I'm trying to say. What that means is that they're going to want to get to the point. Directors like to say things like, what's the bottom line? Get to it. Don't give me all of that. I just want the meat and potatoes. How does this work? What is it? Just show me the money. That's the kind of things that a director says, 15% of the population. Thinkers are also guarded. They have short answers, and they have to know how things work. They're kind of like engineers in the way that they think. They have to know how things are broken down. Very important to understand that if you're talking to a thinker, they're going to have an explanation. They're going to have numbers. They're going to have to understand before they make a decision. Socializers, 30% of the population, and relators, 30% of the population, generally speaking, are both open forms of communicators. They like to share information. They like to tell stories. They like to talk. Socializers like to talk about themselves. Socializers like to be the life of the party. They're the people at a party that are trying to make sure everybody's drinks are filled and want to make sure everybody's having a good time. Okay, that's a socializer. They talk about the team winning. They want to have fun. Okay, that's a socializer. A relator is more like a person that's just overwhelmingly caring about others. Somebody that just has to do for others. It's just a part of their everyday thing. And if they don't do for others, they're just not going to feel good. Relators are people that many times will want to be behind the scenes. Many times they don't speak up. They're kind of a little more quiet when it comes to speaking about themselves. Okay, don't make mistakes in thinking that they're quiet people. They're quiet people about talking about themselves. They want other people to get the limelight, not them. Okay, so that's a relator. Now again, it's important that you understand these four personality types because you're engaging with them every single day, and the better you are at speaking the way they listen, the more effective you are in your communication. Understand these are just guidelines, kind of like a lot of other things. There is no written, black and white on this. This is just a general guideline. Some people are a mixture of several of these personality types. Some people have one that's more predominant than the other. That's common what's in most people. The point is that you begin to learn how to understand and get to understanding where someone's at in their thinking so that you can be effective in helping them. And you connect and you be genuine in your interest in other people. Another quick suggestion on reading material that has made an incredible difference in my life. Someone that I look up to tremendously for the way his thinking has influenced me in my business and in what I do. A gentleman by the name of Bob Burg, B-O-B-B-U-R-G, with his book called The Go-Giver. Okay, not The Go-Getter, but The Go-Giver. Read that book. Amazing, amazing book, guys. Will absolutely make a difference in the way you see your role in business and what you can do in serving the community, how to grow a business. Absolutely. So as we mentioned before, guys, the whole point of this training is that you engage in enrolling individuals. Why is all this important? Because you be an amateur, or you can be a poser, or you can be a pro. If you're going to be a pro, you're going to take your game to another level, and you're going to be learning how to be a professional and engaging people in a professional manner. And that means that your communication skill is top-notch. That means that your engagement skill is top-notch. That means that your way of serving and following through is top-notch. And if you do those things, you're going to be acting in the way of a professional, not an amateur, not a poser. Okay? And obviously, as you're speaking to people and talking to them about what we do, you speak in the way of solutions, not features, not benefits, but in the way of solutions. Okay? What this is going to do for someone, why it might be important to them, how it relates to their current situation. Okay? So, next we're going to talk about signage and station setup. So, as far as signage is concerned, you want to have simple, high contrast type of signage. Nothing fancy, nothing that's going to take you forever to design. One of our team members, Miss Tajuana Harrell down in DFW, came up with some amazing signage. I'll send you guys a sample of that. She gave me permission to do that. I thought it was pretty awesome what she put together. Very simple, but very clean, very nice, sharp-looking signage. I'm going to show you a sample of what we've done, and I'm actually going to copy some of what Tajuana's done. But just amazing what she was able to put together. You're going to love it. But just simple, high-contrast stuff. You want to have a banner, guys, that's 3x5 or 4x6, just as a suggestion. You're going to spend about $50 for that. That's going to go on the outside of a building, okay, wherever you might be enrolling, wherever you might have a location set up. And you're going to also want to have a tabletop type of sign, maybe something that goes behind a laminate stand, a plastic laminate stand. You can buy those at Office Depot for like $12, you know, letterhead size or letter size, or a 12 by 18 inch small sign that goes on a small tabletop easel. Those are about $20-25. And then, or you can have a regular easel sign. Those are a little bigger, 2x3, something like that. It's about as big as you want to go. Those are about $40. You want to get foam core. When you go and get this stuff priced out, you want to get a foam core sign, FOAMCORE, like the kinds that they use for poster boards, for presentations, for science projects. Foam core. They look very sharp, fairly inexpensive. That's probably going to be the easiest way for you to go with that. Okay, simple graphics. You also want to have something that's laminated that you can tape to the table so that when you're not there, other people passing by can see your posted hours, as well as something that has a business card holder, if you will, so that people can pick up a business card if you are no longer there. If you've left the table, they're grabbing your business cards as they're going by. Make sure that you have your cell number written on there. And then you're going to want to have a small table. The table shouldn't be any more than about 2 by 4 feet. Okay, try to find something like that. They sell them at Walmart for about $30. They're black, very sharp little tables. Okay, very easy to carry around, very simple to put away. They're about $35, $40, $50, something along those lines. So just a quick example of the signage that we are using, so that you can see what we're planning. We've actually gone to use inside of the stores and some of the pharmacies, bringing them up on the screen now so you can see. Just a real simple sign. This is what we're using for the indoor, okay? We got quotes for coroplast, but we decided to go with foam core just because it was nicer for the eyes, okay? And then on the bottom here, same spread of message, outdoor banner, ask for the nicer vinyl, okay? Might cost you a few extra dollars, but lasts longer in the weather, and you want to get it with grommets, okay? With grommets so that you can obviously pull the stuff. So don't just get a banner that you can hang somewhere without grommets. That wouldn't make any sense for you to use it outside. So that's what you would want to do for that. Now, the next topic we're going to talk about is how to screen potential enrollees. Okay. A lot of people have been asking me, you know, can I get started today? What do I do? How do I get moving? You know, I feel like I'm getting behind the times, and you need to know you're not. You're further ahead than most agents. Our agency has really taken a lead role. I feel very fortunate and very proud that we are in the blessing in the state that we're in, because, not the state of Texas, I'm talking about the state of where we've been in the business, just because of the fact that we had the experience that we did in Medicare. We saw what happened there, and we saw it coming again with Obamacare, and we took action. Most agencies aren't doing what we're doing. They're so far behind, it's not even funny. They don't have a strategy put together. We're running, we're flying, and you're right there with us, so I'm glad you're on board. You want to go to bereferred.com, and you can start helping people shop. You can start helping people look at rates. Okay, you don't have to wait for that. While you may be getting your paperwork processed, you don't have to wait to start getting this information for people and helping them shop and really evaluate what their options might be. You can start doing that today. Blue Cross Blue Shield of Texas, bcbstx.com, is the largest carrier that's operating around the state. They're the only one that's operating in all part of the state with regard to the subsidy exchange business. Okay, there's other carriers that are operating within the state. They're spotty. They might be working just in one county or another. And Blue Cross Blue Shield is the biggest one. They're the ones to work with because they have the biggest networks as well. Now, healthcare.gov is the government website for you to go on. You can go there and register. I would highly encourage every one of you on this webinar to go ahead and do that, and not only go register, but also go through the motions of everything that you would do for you and your family to see whether you're eligible for a subsidy how that works. Know what the process is by you going through it. Learn what to do with everybody else by you starting. And you may get stuck at one point or another, but you'll get all the way to the very end, and then you'll start to be able to shop for coverage from the providers that are in your particular local area. Now, you can do the same thing again once you're at Blue Cross Blue Shield TX.com. You can enroll people through BCBSTX.com once you have your agent ID number and have gone through the last certification training with Blue Cross. I would not enroll anybody until you've done that part, unless you don't like getting paid. And so obviously you want to get paid. Wait on that part until the end. Realize that most people aren't going to make a decision right away, okay? So the counselors and navigators that Medicare made available, that the Obamacare made available to engage in the community, guys, they don't hold the candle. God bless them. They don't hold a candle to what you're doing as an agent. They don't make a living doing this. They got grant money from some community organization, and they're doing outreach, and God bless them, they're trying to help. But many of these people have 2 weeks of training on trying to explain concepts of medical insurance. You have years of training as an agent and relating with people. You're operating at a different level. So counselors and navigators don't really pose a threat. They're out there to try to help the community, but understand that they are not doing this for a living. They will not be able to support people on the back end because they're only going to be available for a short time. They're just available for the initial enrollment, and that's it. So your advantage is that you do this for a living. You're the guy that's going to take care of servicing the customer when there are issues before you may hand them off to the customer service department of Blue Cross Blue Shield or Cigna or whatever the case might be. So you have a major advantage in that you care not just because your livelihood is at stake, but because it's your business. And the difference between you and everybody else is that. So there is a lot to be said about what you can do in effecting and being effective with other people and helping them understand their options, because you have a lot more at stake. You got more skin in the game, if you will. So here's some screening questions that you can ask people to figure out whether or not you want to spend more time in visiting with them regarding the subject. So first question you need to figure out is, are they marketplace or are they not marketplace prospects? A marketplace prospect is somebody that may be eligible for subsidy assistance, okay? Really the question should be, are they subsidy or non-subsidy, not marketplace or not marketplace. That's wrong bullet point there, forgive me. You should really be figuring out first if they're going to be eligible for subsidy or not. And that'll tell you whether or not you're going to be talking to them about a carrier that is working with subsidies or not. That's really the first point. Now, along that process, you want to ask for name, telephone number, and email address. Even if they might not make a decision right now, this is something that you'll need down the road. You want to build your list of network and your list of contacts. If the timing isn't right for them today, that's fine. It might be good 6 months from now. If you've stayed in touch with them, if you did some follow through with them, then they'll give you the business, because other people won't necessarily follow through and won't necessarily be staying in touch with them. So you use the phrase, if I, would you, again. Most powerful phrase I've heard in what we do in our profession, as well as in a couple of others. If I, would you. So the way you would use that here is, if I could keep you updated on changes as they're occurring, something that would have an impact on your family, would you want me to do that? That's simple. They say yes, most people always do, and you go ahead and get their name, telephone number, and email address. And I'll share with you later how we stay in touch with people. You find a creative and unique way to stay in touch with people. If you add a couple people a day to your network, that's 600 some odd people a year. That's 6,000 people in 10 years. You would never run out of people to talk to if you took this strategy to heart. Okay? One of the things you're going to be determining is whether or not they're eligible for the subsidy, and for that you're going to have to ask questions like household income, household size, how many people are in there that are adults and kids, ages, okay? Whether or not there's health insurance available from the employer or their spouse, and their spouse's employer. Now, the last thing that you want to be able to figure out in your screening questions is the timing. Is the timing right for the person that you're talking to? Are they just kicking the tires? Are they just checking things? Are they just curious? Or are they actually serious buyers right now? And one of the ways you can find out if they're serious buyers is you ask them what kind of premium range they're looking for. And you can just, quite frankly, just ask, well, assuming that you're interested in participating, how many dollars per month were you looking at working with? Are you looking at $200, $300, $100, $150? What's your max and what's your low end? Just so that we can kind of better define what you're shopping for. What would that number be? If they give you a number, well, then they're a little more serious than somebody that's not. If they don't give you a number, that means they're really just curious, okay? So the next point is that you want to ask, quite frankly, if they're looking at making a decision anytime within the next few days or in the next few weeks. And if they tell you, no, I'm really just kicking the tires, I'm looking at making this decision for maybe next year when the penalty is $300, okay. So then you've got their name, telephone number, and email address. You're going to be marketing to them throughout the year so that when it comes time for their time to be right, guess what? You're the guy they call. You're the person they get in touch with. Now, that's a marketing strategy, guys. We used to call that a tickler file. Now, I think I just aged myself. Now we just call it following through. And there's some technology that you can use in a huge way to help you do that. Now, we'll talk about that soon. By the way, that name is bereferred.com, some of the technology that we use to help stay in touch with people. What you need to know next is who is enrolling. Who are the people that you're engaging in high traffic areas? Who is it that you're going to be engaging from your friends and family, and why they're enrolling. So the first year, all the people that are going to be enrolling, guys, are going to be the people that are somewhat sick. 10 to 15% of the population. These are individuals that are already looking for insurance because they've got health concerns or were getting declined. They had high blood pressure. They had diabetes. You know, pretty much any medical condition under the sun was getting a decline. Nowadays, going into 2014, that's gone off the table. So everybody's going to be able to get health insurance. Yay. 10 to 15% of the population is going to be, of the 10 to 15% that enroll now, all of those people are going to be talking to you. They're looking for you. The people that have low or zero premium opportunities in their enrollment, those people are going to be looking for you. Now, there's going to be a ton of people that are already shopping. They happen to already be in the market. They were already looking for some kind of health insurance. Those people are going to be looking for you. And obviously, the fact that it's an open market will bring some other potential prospects to your table. So very important to understand that that's going to be year one. Year two is going to change a little bit. The torch carriers, what we call the torch carriers, are going to be helping to carry your message, and it's going to be coming from the first group. So again, this, remember, you may remember me saying this is about year one and year two are about positioning and putting yourself into a position so that other people will be able to find you when the time is right. That's because the torch carriers are going to bring people to you. They're going to be bird dogging people for you. If you do your job well and you connect with people well and they remember you and they like you and you connected and you were there for them to help them and you led with your heart, if you do all of those things, people will gladly recommend others to you. They will be talking about why you're the guy to go to, okay? And that year, next year, is going to be a very short window, 6 weeks. Year three, same thing, but it's going to be on steroids. More customers will be coming to you. You'll become better known for who you are, not just from customers. But by that time, you're going to have developed relationships within the community. You're going to have centers of influence that you're working with, people that are in banking, people that are CPAs. You're going to have developed relationships with religious leaders in the community. You're going to have developed relationships with other people that have influence in the community. They're all going to be sending people to you, associations, etc. And at that point, year three, you're going to see the rest of the population. 40 to 60% of the population will be enrolling at that time, because they're going to be trying to avoid a $700 penalty. And that will be the most incredible time in our business, guys, because it's just going to be crazy. Okay, so get positioned now, okay? So just some quick tools and options for you. Obviously, this is all about becoming efficient and effective. This whole point that we're on the phone with, the learning to market, the way we market, the sharing some of this information with you, it's about becoming better at what we do by doing it smarter, okay? You can work as many hours as you want to in a day, and that's fine. That'll give you some level of results, but it's not effective and it's not as efficient as you learning to do it better. And that's what we're doing here with you in sharing this information with you. So one of those ways that we do it is we work with an auto dollar. And the setup and the cost of the auto dollar, I'll tell you right now, is $100 for the setup, and it's $100 per month. If you're interested in the auto dollar program, please let me know. You can send that request to JESUSB, Jesus B, okay, JESUSB, as in Bob, as in Bustillos, at plans4life.com. Jesus B at plans4life.com. And at that website address or at that email address, you can just send me a quick note. Jesus, I'm interested in learning more about the auto dollar program. That it's unlimited calls, that is unlimited long distance. There's no other cost to that. It's $100 a month. I'm pretty much doing that at cost just to help us get business running with you, okay? We'll also be helping people with websites. There's two things that are happening with regard to the websites. There's one that we build, and there's one that somebody else will be providing. We're working on wrapping up that project. That'll be announced within the next couple of weeks. If we're able to strike a deal with those people, then you will have a quoting engine, a quoting platform from which you can not only quote people, but share the information with them. Instead of going to healthcare.gov, they would go through your site, or instead of going to the carrier's website, they would go through your site that's branded with your stuff, and then actually help them enroll through your own site. The sites that we are working with that we can help you build are more of a capture for leads and more of a site that will help you with lead traffic. Okay. Just to give you our sites, I'm going to bring that up here on the screen. You can go to these sites at your leisure, and if you want to even register for one of these sites, you can see exactly how they work and some of the technology that we use to help communicate information to our potential customer. So one of those sites is Enrolling.org. And as that site is coming up on my screen in just a second, this is what it is. It's a basic video and a capture form. And these are sites that I build. And for setting up a site like this, the setup cost would be $150. Okay, and that includes some of the resources that you would actually keep that are yours. They're not for me. And again, I'm pretty much doing this at cost. I wouldn't be, if I was charging you money for this, it would be in the hundreds, if not the thousands. So we don't charge people to do this. This is just marketing assistance that we help you with so that we can help you produce and become better at marketing. On the back end, there might be about $40, $50, $100, about $50 in month-to-month costs for you to maintain your own site like this. So just to give you a ballpark, something along those lines is what it would end up costing. If you want help in putting some of this kind of stuff together, please let me know. It's something that we can do. Now, where it relates to the marketing and some of that training that we'll be implementing as a tool, some of the branding and some of the social media training that we'll be doing, we'll be announcing that in the next few weeks and in the next few months. Now that is higher level training. I'm going to tell you, some of you on this webinar will quite frankly be overwhelmed. I know I was. And I got to tell you, it is not only well worth it. If you're in the insurance business today and you don't learn this stuff, you are going to be antiquated. You are going to be a relic. Okay? You need to, if you can, just do your best. I'm not saying it's simple, okay? It's not that hard, but it's just learning. And as long as you've got the attitude to learn, anybody can learn this stuff. Anybody. It's just about just deciding that you're okay learning. I've got people that we're working with on this endeavor that are in their 70s. So I don't want to hear from anybody out there that says, well, I'm too old and you can't teach an old dog new tricks. That's nonsense. It's all about attitude. So if you want to learn this, I would highly encourage you to do so. We can help you learn how to do some of what we do in the way of marketing and training with branding and social media. If you're interested in building a hierarchy, we can definitely help you in building a hierarchy. Some of the contracts that we work with have room for us to be able to build in people that want to help us recruit, people that want to grow an agency. So if you're interested in that, just remind me, let me know, communicate with me one way or the other that that's something that you want to discuss. Last but not least, guys, is leads. We will be having an auto dialer campaign in certain markets like Houston, Dallas, Corpus Christi, San Antonio, Austin, Tyler, Longview, Midland, Odessa, Lubbock, Amarillo. And these calling campaigns will be to businesses and they will be to consumers. So if you do not participate in the auto dialer program, that's okay. Okay, you don't have to participate in the auto dialer program. You own the leads that come from that traffic. Please understand, for $100, you won't find a better value to help you drive traffic. Okay, but if you don't participate, we will be giving away some of these leads. But you're going to be sharing them with whoever else is in that market. So it might be 5 a month, it might be 2, it might be 1 a month, it might be 50. There's just no way to tell us until we get into this, as we're getting into it now. But if you want to have some control and you want to have some ownership on that, I would set up an auto dialer line for yourself. Okay. So these leads will be we will also be making available free consumer leads that are scrubbed from the do not call lists for businesses as well as for consumers. So those are free. If you want me to get you lists of people to call to. I mean, we don't even recommend you market that way. It is one of the least efficient ways to market. But if you want to get out there and beat the streets and knock on doors and do that kind of thing, which I don't recommend, you can do that. We'll provide you leads for that, as well as hammering the phone. But there is a much more efficient, a much more effective way to do what we do, and that is to go through these trainings and learn to market in a way that's more efficient by building some of these techniques that we're talking about. There will be other carriers that we work through. Some of these companies are more regional, smaller networks, don't have a lot of experience working with agents. So we're being very careful in entering into some of those relationships. We've been down the road before where we start working with a carrier and then they have money trouble and then they don't pay us. So we don't want to just work with anybody. Please understand that just because someone's got a great product, that doesn't mean you want to work with them. If they're an insurance company, you want to make sure that they've got some backing, that they want to stay in the business long term, because that'll affect your residuals 5 to 10 years from now. So we are looking at some other carriers, and that'll be coming to you very, very soon. Now, the last slide here, guys, some of the action steps that you want to go through. Okay? Remember, we're doing this to build long-term relationships. Always lead with your heart. People buy you. They don't buy the product. They don't buy the carrier. They're buying the relationship. And if they know they're going to have somebody in their corner and you make them feel good about the purchase, about the transaction, about the relationship, they're going to love working with you and they're going to want to do business with you. So lead with your why, whatever your goal is, whatever your driving passion is. And the enrollment will be more of an automatic. People will just naturally want to do business with you, okay? Start with the memory jogger as soon as possible so that you can identify what your current market is. It doesn't matter what business you're in, any business. It doesn't matter if you're talking about a taco stand or if you're talking about a barber shop or any of that. Their first step in formulating a business plan and effecting a marketing strategy is to know who your market is. And if you have friends and family, guys, it is a total mistake to forego those people and to not talk to them about these particular plans, because someone else will, and then you're going to be kicking yourself if all of your cousins and aunts and uncles bought from someone else when they already know, like, and trust you. So definitely make your list so that you can track some of those conversations and some of those communications and some of those engagements, monitor and measure so that you can figure out what works and what works best in the way of your scripts and conversations, okay? And then we're going to be doing some referral training online, the first of which will be available in 2 weeks. Obviously, next week we're doing another webinar. Please listen up for that. That's going to be coming out on Friday at 11:30. That's the one for businesses. This is the one for individuals. Next week will be businesses. So make sure you secure yourself in a location. Anywhere that's high traffic, we've given you some language here so that you can secure a location. If you need help with that, please, by all means, reach out to me. I am at your service and being able to help you. Start calling some of those people. You can start making contacts today. You can start talking to people today. Start scheduling appointments today, presenting some of these basic concepts, okay? And going through the screenings, you can learn who's really ready to make a decision today, who's going to be postponing you anyway for the next couple of weeks, and really knowing who your current prospects are. Now, you can do presentations one-on-one. I wouldn't do that unless I'd gone through a screening. Or you can do events, groups, presentations, seminars, marketing webinars. If you're ready to do anything like that in the way of a group, please contact me. I've got resources and tools to help you do that, and I can help you with some guidance on what works very, very well and how to maximize those efforts. Last but not least, have fun. Go serve. Make a lot of money. Guys, again, this is Jesus Bustillos. It's been a blessing and an honor to be with you for this last hour and helping you learn how we're engaging and working with individuals. You are hearing a pre-recorded webinar, and if you need any help, if I can be of assistance to you in any way, you have but to reach out and get a hold of me. 915-591-1957. Have a blessed day.